Cucumbers are known for their health benefits, but did you know they can cause problems if you're taking certain medications? In this video, we'll talk about which medications may not mix well with cucumbers and how to safely include them in your diet. Blood thinners Mary, a 65-year-old from Florida, had a daily habit of adding cucumbers to her salads. However, after being diagnosed with a heart condition, she was prescribed warfarin, a common blood thinner. One day, Mary noticed that she was getting bruises more easily than before, which worried her. When she consulted her doctor, he advised her to pay closer attention to her diet, especially her intake of cucumbers. Cucumbers are rich in vitamin K, a nutrient that plays a key role in blood clotting. Unfortunately, vitamin K can interfere with the effectiveness of blood thinners like warfarin, making the medication less effective or even dangerous. This interaction can lead to serious health issues, such as unexpected bleeding or clotting problems. If you're taking blood thinners like warfarin, it's important to be mindful of your cucumber consumption. The safest approach is to consult with your doctor to determine how much cucumber is safe for you to eat without compromising the effectiveness of your medication. For people like Mary, managing their diet while on blood thinners can be challenging, but it's crucial for maintaining good health. While cucumbers are generally considered a healthy food, their high vitamin K content can pose a risk for individuals on blood-thinning medications. This doesn't mean you have to completely eliminate cucumbers from your diet, but moderation and careful monitoring are key. Your healthcare provider can guide you in balancing your love for cucumbers with the need to manage your medication effectively. By working together with your doctor, you can continue to enjoy your favorite foods without putting your health at risk. Remember, it's always better to ask your healthcare provider before making any changes to your diet, especially when it involves foods that could interact with your medication. Beta blockers John, a 70-year-old man from Toronto, had been prescribed beta blockers to manage his high blood pressure. He enjoyed snacking on cucumber slices, finding them a refreshing and healthy treat. However, after some time, he began experiencing unusual heart palpitations, which alarmed him. Concerned about these new symptoms, John sought advice from his dietitian, who suggested that the cucumbers might be contributing to the problem. Cucumbers are high in potassium, an essential mineral that plays a critical role in heart function. However, when you're on beta blockers, which are designed to slow down the heart and reduce blood pressure, consuming too much potassium can lead to an imbalance. This imbalance can cause symptoms like heart palpitations or even more severe heart-related issues. Therefore, it's important for individuals on beta blockers to be cautious about their potassium intake, including from foods like cucumbers. For those like John, managing potassium levels while on beta blockers is essential for avoiding complications. While cucumbers are nutritious and low in calories, their high potassium content can pose a risk for people on certain heart medications. It's not necessary to completely avoid cucumbers, but moderation is key. By working closely with a healthcare provider or dietitian, you can determine the appropriate amount of cucumbers that fits your diet without compromising your medication's effectiveness. Keeping an open line of communication with your healthcare team ensures that you can enjoy your favorite foods while maintaining your health. Always remember that when it comes to managing your health, particularly with medications, informed choices are the best choices. Diuretics Evelyn, a 68-year-old woman from London, was prescribed diuretics to help manage her congestive heart failure. Diuretics are medications that help remove excess fluid from the body by increasing urine production, which can be crucial for people with heart conditions. Evelyn enjoyed drinking cucumber water, believing it was a healthy choice that kept her hydrated. However, after some time, she began feeling lightheaded and weak, symptoms that were unusual for her. Concerned about these new feelings, Evelyn spoke with her dietitian, who suggested that her cucumber consumption might be contributing to the problem. Cucumbers have a mild diuretic effect themselves, which means they can increase urine production and potentially enhance the effects of diuretic medications. This combination can lead to dehydration and an imbalance of electrolytes in the body, which can cause symptoms like dizziness, weakness, or even more severe health issues. For people like Evelyn, managing fluid and electrolyte balance is crucial when taking diuretics. While cucumbers are generally considered a healthy and hydrating food, their natural diuretic properties can pose a risk for individuals on diuretic medications. It's important to stay well hydrated, especially when taking diuretics, but you also need to be mindful of foods that could potentially enhance the medication's effects too much. If you enjoy cucumbers, it's wise to consult with your healthcare provider or dietitian about how much you can safely consume. They can help you find the right balance between enjoying your favorite foods and maintaining your health. Remember, managing your diet carefully can help prevent unwanted side effects and ensure that your medication works as intended. ACE inhibitors. Peter, a 72-year-old from New York, was taking ACE inhibitors to control his high blood pressure. ACE inhibitors are a common class of medication used to relax blood vessels and lower blood pressure, making it easier for the heart to pump blood. Peter had a particular fondness for cucumbers, often adding them to his meals. However, after some time, he began to experience muscle cramps and persistent fatigue, which were unusual for him. Concerned about these new symptoms, Peter consulted his nutritionist, who pointed out that cucumbers might be playing a role in his discomfort. Cucumbers are rich in potassium, and while potassium is essential for many bodily functions, too much of it can interfere with the effectiveness of ACE inhibitors. Elevated potassium levels, known as hyperkalemia, can cause muscle cramps, fatigue, and even more severe health issues like heart problems. For individuals like Peter, monitoring potassium intake is crucial when taking ACE inhibitors. While cucumbers are nutritious and offer many health benefits, their potassium content can be problematic for people on certain medications. This doesn't mean you need to eliminate cucumbers from your diet entirely, but it does mean that you should be cautious and aware of how much you're consuming. Regularly checking your potassium levels and consulting with your healthcare provider can help you manage your diet more effectively while on ACE inhibitors. By staying informed and working closely with your healthcare team, you can continue to enjoy your favorite foods without putting your health at risk. Making small adjustments to your diet can have a big impact on your overall well-being, especially when managing chronic conditions like high blood pressure. Statins. Linda, a 60-year-old from Vancouver, was taking statins to manage her high cholesterol levels. Statins are commonly prescribed to help lower cholesterol and reduce the risk of heart disease. Linda enjoyed cucumbers as a healthy snack and often included them in her meals. However, she started to notice muscle pain and weakness, which were new and troubling symptoms for her. After discussing these issues with her dietitian, it was suggested that her cucumber consumption might be affecting her statin medication. Cucumbers can interfere with the metabolism of statins, potentially leading to increased muscle pain and weakness. This is because some foods can impact how well statins work, causing side effects that are uncomfortable and concerning. For people like Linda, managing the side effects of statins involves paying attention to dietary choices. While cucumbers are typically considered a healthy food, they can affect the effectiveness of statin medications, leading to unwanted side effects. It's important to find a balance between enjoying cucumbers and ensuring that your statin medication remains effective. If you're on statins and experiencing muscle pain, it's a good idea to talk to your healthcare provider about your diet and how to adjust it. They can provide guidance on how much cucumber you can safely consume without impacting your medication's effectiveness. By working with your healthcare team and making informed dietary choices, you can continue to enjoy your favorite foods while managing your cholesterol levels effectively. Anticoagulants. James, a 70-year-old from Chicago, was prescribed anticoagulants after experiencing a stroke. Anticoagulants are medications that help prevent blood clots and reduce the risk of further strokes or heart problems. James enjoyed eating cucumbers, but he began to notice unusual bleeding, which worried him. When he spoke to his dietitian, it was suggested that cucumbers might be contributing to the problem. Cucumbers can affect blood clotting, which can interfere with how well anticoagulants work. This interaction can increase the risk of bleeding, which is a serious concern for individuals taking anticoagulant medications. For individuals like James, managing anticoagulant therapy involves being careful with dietary choices. Cucumbers, while generally healthy, can impact blood clotting and potentially increase the risk of bleeding when taken with anticoagulants. It's important to monitor your intake of cucumbers and discuss any changes with your healthcare provider. They can help you understand how to balance your diet to avoid interactions with your medication. By being proactive and informed about your food choices, you can help ensure that your anticoagulant medication remains effective and minimize the risk of complications. Always consult with your healthcare team before making any significant changes to your diet, especially when managing medications that affect blood clotting. Anti-diabetic medications. Barbara, a 68-year-old from Glasgow, was managing her diabetes with medication to keep her blood sugar levels in check. She enjoyed cucumbers as part of her diet, believing they were a healthy choice. However, she started noticing fluctuations in her blood sugar levels, which made her concerned. Her dietitian suggested that cucumbers might be affecting her blood sugar control. Some research indicates that cucumbers can influence blood sugar levels, potentially interfering with the effectiveness of anti-diabetic medications. This interference can lead to less stable blood sugar levels, which can be challenging for someone managing diabetes. For individuals like Barbara, maintaining stable blood sugar levels is crucial when on anti-diabetic medications. While cucumbers are low in calories and provide various health benefits, their effect on blood sugar levels needs to be monitored. It's important to talk to your healthcare provider about how cucumbers fit into your diabetes management plan. They can help you understand how much cucumber you can safely include in your diet without affecting your medication's effectiveness. By working with your healthcare team and making informed choices, you can continue to enjoy cucumbers while keeping your blood sugar levels stable and under control. Anti-seizure medications. Henry, a 66-year-old from Philadelphia, was taking anti-seizure medications to manage his condition. He enjoyed cucumbers as a snack, but began to experience an increase in seizure activity, which was concerning. His dietitian suggested that cucumbers might be interacting with his medication. Some studies suggest that cucumbers can interfere with the absorption and effectiveness of certain anti-seizure medications, potentially leading to increased seizure activity. This is because cucumbers might affect how well the medication is absorbed and used by the body, which can be problematic for managing seizures effectively. For people like Henry, managing seizure control is essential when on anti-seizure medications. Cucumbers, while nutritious, can impact the effectiveness of these medications and potentially lead to more frequent seizures. It's important to discuss your diet with your healthcare provider to determine how much cucumber you can safely consume. By monitoring your symptoms and working closely with your healthcare team, you can find a balance that allows you to enjoy cucumbers while ensuring your medication remains effective. Always seek professional advice before making changes to your diet, especially when managing a condition as critical as seizures. Chemotherapy drugs. Diana, a 70-year-old from Dublin, was undergoing chemotherapy to treat her cancer. She enjoyed cucumbers as part of her diet, but she started to notice increased nausea and fatigue, which were significant concerns. Her dietitian pointed out that cucumbers might be interfering with her chemotherapy drugs. Research suggests that cucumbers, along with other foods, can affect the absorption and effectiveness of chemotherapy medications. This interaction can lead to intensified side effects, like nausea and fatigue, which can make the treatment process more difficult. For individuals like Diana, managing side effects during chemotherapy is crucial for maintaining quality of life. While cucumbers are a healthy food choice, they can impact how well chemotherapy drugs work and exacerbate side effects. It's important to work with your healthcare provider to understand how cucumbers fit into your diet during treatment. They can help you determine how to adjust your intake to avoid interfering with your medication. By staying informed and making careful dietary choices, you can help manage your side effects and support the effectiveness of your chemotherapy treatment. Always consult with your healthcare team before making any dietary changes during chemotherapy to ensure you are managing your treatment and health effectively. Antipsychotic medications. Paul, a 69-year-old from Seattle, was prescribed antipsychotic medications to help manage his mental health condition. He liked eating cucumbers as a healthy part of his diet. However, he began to experience increased agitation and restlessness, which were troubling symptoms for him. After discussing these issues with his dietitian, it was suggested that cucumbers might be interacting with his antipsychotic medications. Research has shown that cucumbers can affect serotonin levels in the body, which might interfere with the action of certain antipsychotic drugs. This interference can potentially lead to increased agitation and restlessness, making it harder to manage his condition effectively. For individuals like Paul, maintaining a stable mood is essential when on antipsychotic medications. Cucumbers, while generally healthy, can impact serotonin levels and potentially disrupt the effectiveness of these medications. It's important to discuss your dietary choices with your healthcare provider to understand how cucumbers might affect your treatment. By monitoring your symptoms and working closely with your healthcare team, you can find the right balance between enjoying your favorite foods and managing your condition. Always seek professional advice before making changes to your diet, especially when it involves managing complex conditions like mental health disorders. Cucumbers can be healthy, but if you're on medication, it's important to be mindful of how they might affect you. Always talk to your healthcare provider before making changes to your diet. If you want to learn more about foods that seem healthy but can have side effects, subscribe to the channel.